talk. I don't think we have to even call on people. Right now we have 12. Is it 12? Is that right?
Stacy. Yeah. Did you get ice? I need ice.
Is that Lori?
It's Lori.
second? Yeah.
Yeah. I recognize everybody's unique Zoom IDs.
Hi.
Lori?
Yes, hi.
Hi, Lori. How are you?
I'm good. How are you?
Good.
That name that comes up is my Zoom name for my class, and I have to change it every time. But so
I didn't see it. What's the name?
It says IREP. I think it says IREP teacher or IREP second, or it means interreligious, interparish religious education program. That's what it stands for.
Oh, so you're doing your CCD Zooming?
Yeah. Oh, yeah. I've been doing it all along.
Oh, I forgot
Yeah.
to ask you what you were doing. Great.
Yeah.
And it works out okay?
Yeah, it's actually great. I really like it because it's like, you've got the kids like right there. They can't, like if they're fooling around, they're right in your face, and you can you can like put them in the waiting room again,
They haven't learned how to turn off their video. They haven't learned that one yet.
No, they they can't. They do it, but I'm like, you guys have to come back to class or I'm not, I'm not going to do this. Anyway, no, it's good. I've really been enjoying it. It's been a lot of fun. And what I say is like, I'll teach you about religion and you'll teach me about computers. Cause like I learned how to play a video for them, so it's good.
How old are they?
Second grade. They're like 7 and 8.
A good age.
Yeah, it's really good. It's really good.
Sorry,
So
one second. Deirdre, you can hear us, but we just can't hear you. You're speaking right now. So I think she just tried to leave and will come back, and we'll see if that fixes it. If not, I'll do some other troubleshooting.
Okay.
You do have more than 10 people now, so I would recommend just doing a standard meeting. So I'm going to go ahead and read the pre-meeting talking points while we wait for her to rejoin.
And you'll tell me as soon as Rebecca comes. Okay, Rebecca Seawright.
Yes.
Okay.
Yes, and I see her staff member is here as well, so she can chat me if Rebecca's on her way. So welcome to everyone. If this is your first time joining us for one of our CB8 virtual meetings, welcome to the last day of 1 year of doing these. Tomorrow represents the 1 year anniversary of our first one of our Zoom committee meetings. So if it's your first time, you'll notice that everyone is muted and you'll be muted throughout the meeting. And only the co-chairs, Barbara, Rebecca, and Wilma will be unmuted, and our presenters when they're making their presentations. Following the presentation, the co-chairs will call on members of the public who wish to speak. You can participate by going to the reactions icon and pressing the raise hand button. It's not the wave or the thumbs up, those will disappear. And you should only press the raise hand button once. If you press it a second time, your hand will go back down. If you're on the phone, it's *9 to raise your hand and *6 to unmute. Be on the lookout for a prompt asking you to confirm unmuting once the co-chairs call on you. The chat is available for technical support with the Zoom platform. It is not available to ask questions of the co-chairs or the presenters. They will not see any of those chats. If you're using an older version of Zoom, you'll need to go to the participants section where you can find the raise hand feature there. And finally, just please do not raise your actual hand. Though it is a small group, we may miss you, and we don't want to miss your trying to get our attention. So use the raise hand feature under the reactions button. I see Deirdre has rejoined us. Let's see if she can.
Okay.
Hey, we can hear you now.
Okay,
That's
good. Woo, thanks.
Wonderful.
Sorry, guys. I don't know. Technology, yikes.
It is a year later, but we're lucky to have Will. So I'm going
Yes,
to get
thank you,
started.
Will.
Welcome to the Health Senior Social Services Committee of Community Board 8. And we've been tackling a lot of problems. The problems of nursing homes have been in the news for months at this point, and we're so pleased that we were put in touch with Deirdre Garrett Scott, who is an expert in and understands certain legislation. I don't even know the status of this, whether it's passed both houses. Some have passed one house or the other, some have passed both, and Deirdre will tell us about it. Deirdre is the director. It's such a long title that I'm going to read it. She is the director of Long-Term Care Ombudsman Center for the independence of the disabled. I think I said that right, Deirdre. And what I was asking Deirdre before the meeting started is a couple of things. First of all, to explain exactly what that all means and what exactly you do. But also, as she goes through the different bills, I think, and discusses it, I've noticed that different words are used. And I'm curious to know what they each mean, or are they synonymous? Long-term care, nursing homes, assisted living, rehab centers. What are the difference between it and which laws will belong and so on. So thank you so much, Deirdre, for coming, and want to hear everything about nursing homes that you know.
Okay, well, thank you, Barbara, and the committee for having me. My name is Deirdre Garrett Scott. I'm the director of the New York City Long-Term Care Ombudsman Program, and we are housed at Sydney, the Center for Independence of the Disabled. The Ombudsman Program is a federal and state funded program. There are 15 regions throughout New York State. New York City is Region 3, and we are the largest region. Meaning we have the most nursing homes. We currently have 171 nursing homes and 111 other facilities, such as assisted living and adult care facilities. So that gives us about a little over 55,000 beds throughout the city. The Ombudsman Program is a resident-centered program where we advocate for long-term care residents. So long-term care residents, meaning residents residing in a nursing home, an assisted living, or an adult home. We normally cover facilities that are covered by Medicare and Medicaid. So if those facilities have contracts with Medicare and Medicaid, we are required to provide advocacy, education, and empowerment assistance to those residents. Although we do assist family members, our population that we serve are the residents. And that's why it's a resident-centered program. And what that means is, if there is a resident who has a complaint in regards to any type of care or concern that they're facing at their long-term care facility, and they want assistance from the ombudsman, we are there to assist them. But sometimes family members will reach out to us without speaking with their loved ones and ask for assistance on behalf of the resident. And when we do get calls, or when we were in the facility, visiting our facilities on a weekly basis, we would be approached by family members asking for assistance. We always have to inform families that we have to check with the resident first. The resident has to want our services. If the resident does not want assistance from the ombudsman, there's nothing that we could do to assist that family member in resolving an issue or complaint on behalf of that resident. We must receive permission from the resident. If the resident says, well, I'll call you at another time, or, maybe come back to me next week, then we will follow up with that resident. But if the resident is stating that they do not want assistance at that particular time, we do not provide any services on behalf of that. We don't act on behalf of that resident. So I just want that to be clear. Another thing is, a lot of times our program is confused with the New York State Department of Health. We are two separate entities. The Department of Health is the regulatory entity. They are the entity that goes into facilities on an annual basis or based off of complaints by a resident or family member or another stakeholder and complete an investigation. They are the only ones who can cite a facility. We do not cite a facility. We cannot cite a facility. We advocate on behalf of the resident, and we try to mediate to a point where the Department of Health does not have to get involved. So we're able to resolve a complaint on behalf of a resident. 9 times out of 10, that complaint won't escalate to the Department of Health. Some complaints do, especially complaints that are based off of abuse, neglect. Those type of complaints must be reported to the Department of Health. And in regards to the nursing home bills per se, the wording, legislators use different terminology. Nursing homes are nursing homes. Some of the bills indicate residential care facilities. Some of these bills indicate nursing homes, adult care facilities, or they'll spell out nursing home, assisted living, or adult care. Some bills may pertain to group homes that are operated for a different special need, such as the Office of Disabilities. We do not oversee those facilities. So the Office of OPWDD, we do not oversee those facilities, but we only oversee the nursing homes, assisted living, and the adult homes. So when a bill states long-term care facilities, usually that means a nursing home, an assisted living, and adult home. Because I missed the beginning, so is there any other question?
Can you go over the bills, what the status is? Just not the details, but that overview that you had sent to us.
Sure. So 2 of the bills passed. One was the Essential Care Visitor Bill. That bill was drafted by Senator May, and she had numerous support on both houses, the Senate and the Assembly. And basically, that's a new bill. That bill came from advocates, family members, residents, speaking out about their situation during the pandemic. In a nursing home population, normally prior to COVID, family members are usually very hands-on with the care of their loved ones. Some may be real hands-on where they'll come to the facility, provide ADL care. They may assist with feeding. A lot of families do feedings. They may assist with showering. They may escort their loved one to a medical appointment. So during the pandemic, they were locked out, and family members were not able to see their loved ones And what they were seeing when they were able to visit, or what they were seeing virtually, was their loved ones were declining. And this bill also came in light of the compassionate care bill, the compassionate care visit, excuse me, where it was really trying. It was a really trying time at the beginning of the pandemic. I would say from April to July, where family members really had difficult times trying to get a compassionate care visit because the guidance was not clear. It was very vague, and it basically, it was at the discretion of the facilities as to whether or not a family member, a resident met the criteria for a compassionate care visit. And family members, voiced their concerns that because they weren't able to get into the facilities to provide hands-on care for their loved ones, many of them stopped eating, didn't want to get out of the bed, their mental health declined, they were depressed, anxious, withdrawn. And last summer, when the legislation held the nursing home reform conferences for family members and other stakeholders, they heard a lot of that because they were not able to, be in the facility and be hands-on, their loved ones either declined or unfortunately, they passed away. And this bill was to try to alleviate any further devastation for a family member and a resident where they will be separated for such of a long period of time, especially, during this time, because there was so much uncertainty. It was so much back and forth with visitations on, visitations off. Facilities weren't complying with the compassionate care visit. They weren't offering outdoor visits. They were limited indoor visits. There was so much limitations. So this bill gives residents the choice to choose 2 designated family members or friends or, a legal guardian to be able to come in and be active in their care. And this bill passed this week. The governor signed it. It passed in both houses, and it went to the governor and it was signed. So it is a law now. The Department of Health has 45 days to implement the regulations to provide to the nursing homes so that they can comply with this new law. One of the other bills that passed was in regards to involuntary, voluntary transfer and discharge of a resident from a nursing home. There has been so much, I would say, chaos, and so many residents being discharged involuntarily against their will, family members not knowing what the residents' rights are, residents not understanding what their rights are, residents being discharged to shelters, residents being discharged to family members not being aware that, the discharge notice indicates their home location, no preparation, no safe planning for the resident and families not involved in the actual discharge planning process. So this bill that passed this week also, it coincides with the federal regulations that notice must be given in a timely fashion, and the timely fashion is 30 days. The resident has a right to appeal the discharge. You just can't put an address on a discharge notice telling and handing it to a resident and saying, okay, you have 30 days to be discharged to this location. We're discharging you to this location. So it protects the resident. It coincides with what the federal regulations has been since 2016 to protect the residents against unlawful discharges to anywhere that they're not comfortable or safe being discharged to.
Why were they discharged? Why?
Many reasons. Nursing homes have changed so much in the past 10 to 15 years. A lot of facilities have been sold and they're now operated by corporate entities where the corporate entities are for profit, and residents who have been at nursing homes for years are considered long-term residents. They are covered through Medicaid.
I see.
And although they still may have active Medicare, but Medicaid is actually paying for their stay there. So, you know, facilities don't see those residents as a moneymaker. They're not as lucrative as a short-term resident would be. The dollar amount from Medicare is higher than what Medicaid pays. So a lot of facilities were making room for their short-term rehab residents and slowly discharging their long-term residents maybe to another sister facility or another nursing home, or saying that the resident no longer required that level of care. They would try to discharge the resident to a shelter, maybe to an assisted living or an adult home, depending on the resident's age and also the resident's medical condition. So these residents didn't have a clue. A lot of residents don't have a clue that they do have the right to appeal. And 9 times out of 10, the residents require this level of care. That's why they're there.
Right.
And to discharge a resident from one facility to another nursing home to say that the resident no longer requires skilled care, it doesn't make sense, because every nursing home basically provides the same level of care. It has to be justified as to why your facility cannot provide the care that the resident needs. And the laws that were put in place on a federal level weren't being followed on an enforcement level on a state level. Our program and all other ombudsman programs across the country were mandated by the federal government to receive discharge notices. So we know when a resident is being discharged, especially involuntarily. A lot of times there's no planning for the resident. The facility will just provide the resident with the notice and say, hey, you know, you're going here on X, Y, and Z date. A lot of facilities were not providing the resident with 30 days. There's a reason why there's a 30-day law for the resident, because it gives the resident enough time to appeal to the Department of Health. They have 15 days to appeal that discharge notice to the Department of Health. And once a resident appeals that notice, they have the right to remain at the facility until there is a hearing by the Department of Health and a determination is made by the Department of Health. So, you know, a lot of times the ombudsman program would get involved or gets involved with the resident's permission to assist the resident in calling the Department of Health, requesting for an appeal, being present at the discharge hearing, educating the resident on their rights, talking to the facility as to why they're discharging the resident, educating the facility that they're in the wrong a lot of times, There has been success stories where the Ombudsman program has been able to get a facility to overturn involuntary discharge, sometimes without getting the Department of Health involved. But a lot of times, reasons why the facilities are issuing notice is because a monetary reason. So those two bills passed in the Senate. The governor signed off on the essential care givers bill and the transfer discharge voluntary, involuntary bill. There are some other bills that are just as important, but has not made it to the governor yet, such as the safe staffing ratio.
Yeah,
That's a critical bill.
Yeah.
Critical. This bill has been around more than 15 years. But due to COVID, I think legislators have really realized that staffing is a major concern. It is a major impediment on residents being provided with the quality of care that they deserve. You know, many facilities, like I stated, are corporate owned. So they don't only utilize union staff. Usually when a facility is sold to a corporate entity, they do their best to get rid of the union staff and they hire agency staff. And relying on agency staff, it cuts, again, costs where they don't have to pay the staff member benefits and so forth. So they work for the agency, they don't work for the nursing home. And that also impedes on the residents' quality of life because it's a lot of turnover. Usually when there's a union present, these staff members have been with the facility for a long time. They know the resident, they're able to provide the care for the resident feels comfortable with that particular staff or with those particular staff members. And you'll find that, you know, a lot of the facilities have one unit is 40 residents. Out of those 40 residents, you may have 3 CNAs caring for 40 residents. This is why residents are waiting hours on end to go to the restroom, waiting sometimes to get their showers. Sometimes residents miss showering because they're short of staff. Medications aren't given in a timely fashion. There's only one LPN to give meds for 40 residents. So the staffing levels on the LPN and the CNA level are critical because these are the professionals who are providing the actual hands-on care for residents, especially the CNAs. And when a CNA, you know, is working from one facility going to another, that's not good either, because it impedes on the resident's quality of life, where that CNA, you know, is burnt out already, and he or she, or if it's an orderly, will have to take on the task of caring for maybe up to 10 residents sometimes. Their caseload is, you know, enormous, and they're not able to provide that individual, that resident-centered care. And, you know, another issue in regards to safe staffing levels and why family members, you know, were so adamant on, you know, being locked out, they don't take the time to feed residents. So family members, you know, they come in, lunch, dinner time, sit with their loved one, feed the resident. You have residents who have a diagnosis of dementia or mental illness. They're not going to eat their food as fast as someone else who doesn't have a mental illness or Alzheimer's or dementia. So those reasons alone is critical for staffing to be at a ratio where residents are given the care that they need, not only in an adequate manner, but in a timely fashion. Residents waiting for to use the restroom. A lot of residents, they put residents in a diaper and the residents are soiled hours on end, and that causes the residents to have skin breakdown. And then you have ulcers. So, and then you have the nutrition factor with it. So there's multiple factors that play into the staffing level that I don't think legislators and others really understood until COVID. And I'm hoping that this bill will move forth in both houses and get the governor's signature quicker than later, because it is critical. Another bill.
Before you move to that next bill, I'm sorry I had to interrupt you, but our Assemblywoman has joined us, and I know she has a limited amount of time.
Right.
So,
Assemblywoman Rebecca Seawright, thank you so much for coming.
Thank you. It's great to join you this evening. And Ms. Garrett Scott, I love your title, Director of Long-Term Care Ombudsman Program, the Center for the Independence of the Disabled in New York. And we all thank you for your advocacy on behalf of the independence of the disabled in New York and the long-term care community. And I hear strongly what you're saying. I was a co-sponsor of the Safe Staffing Bill, as well as many other bills that we recently passed, the nursing home bills. And we do need to put pressure on the governor to sign the legislation. So I encourage all of you to write the governor and ask him to sign that bill. He has 10 business days to sign it after it's transmitted to him. And it's usually a big negotiation between the Assembly and the Senate to figure out what bills are going to be transmitted. I remember the story a couple of years ago when around Thanksgiving, they transmitted 400 bills to the governor, and everyone was working through Thanksgiving to get the governor to sign them. So getting that bill signed by the governor is absolutely key. But I want to thank Rebecca Dangor, Wilman Johnson, and Barbara Rutter for your work on behalf of the Health, Seniors, and Social Services Committee. Yesterday, Kaz and Barbara joined us on a walk through the neighborhood with the Department of Sanitation to identify areas in need of improvement. So thank you for joining us, and please let us know if you have any issues that you want to flag, because we are featuring the Commissioner of the Department of Sanitation on our town hall this coming Tuesday. We had identified areas of concern with garbage, especially on 86th Street. So that's what prompted us to invite him to do this tour with us around the neighborhood, and also to be a guest speaker on our town hall. It's been a busy budget season. We're working through this Easter weekend, unfortunately, on the budget. Last night we passed it around close to midnight, the debt services bill, and recently passed the Marijuana Act. We'll be working this weekend to pass the other 6 budget bills. I was appointed to the Ways and Means Committee by the Speaker this session. And so working on the budget is a lot of work, but we are very fortunate that our leader in the Senate of the Finance Committee is our own Liz Kruger, who was also the lead sponsor of the Legalization of Marijuana Act. As you know, the pandemic threw the state into a wartime footing at hospitals and nursing facilities across our state. I see Peter Patch and Lynn Strong and Judy Birdie on, and so many others that helped us form the Kohler Task Force in response to Vincent and other patients and staff at Kohler Hospital, that the conditions were just unacceptable. Especially early on, they told us that the mayor's office, they wouldn't be transferring COVID patients to Kohler, and then they did. But we've addressed some of the issues seen in the nursing home and long-term care facilities, passing legislation in the face of residential facilities putting profits over patient care. In some cases, they discharged and transferred patients and that really lacked the care that they needed. As as we've all seen. So I'm on the Judiciary Committee, and we are charged with investigating 3 things on the governor, which I can't really comment on, but I can tell you what the 3 charges are. And one of them is the nursing home deaths, sexual harassment, and the Mario Cuomo Bridge scandal. Today, we released a hotline number for people to call to our independent outside investigative counsel if you have or know anyone that needs to call the hotline about complaints. It's Sexual Harassment Awareness Month. I'll be introducing some legislation. And on Tuesday, in honor of Sexual Harassment Awareness Month, we'll be hosting a press conference with a lot of the victims that were the lead plaintiffs in the Harvey Weinstein case. Just a side note, I'm not turning on my video because I've found that when I turn it on, then the audio gets very, very choppy. And so I'm going on another Zoom right after this one, and I was on one right before this one, and people couldn't hear me. So that's why I'm leaving the video off. But I was a proud co-sponsor of to cast my vote for Assembly Bill 3397 to repeal Article 30D of the Public Health Law, also known as the Emergency or Disaster Tenant Protection Act, which will enable us to hold facilities and administrators accountable for the harm to patients and residents. As I mentioned, on Roosevelt Island, we're still working closely with Kohler Hospital and the Manhattan Task Force on it to improve conditions there. But we're holding the administrators of these facilities accountable for harm and damages incurred to vulnerable individuals. The pandemic revealed areas that need improvement beyond the confines of this health crisis. So we passed legislation to implement quality improvements, the re-imaging of the long-term care task force with advocates from across the long-term care system, requiring a study and a report to the governor and the legislature on the state of the long-term care services, codifying New York regulations and federal law that establishes certain requirements prior to an individual being transferred or discharged from a residential health care facility, Assembly Bill 3919, which I'm a co-sponsor. We also passed legislation to increase oversight and transparency with a bill prohibiting the granting of new for-profit nursing home licenses or expanding the capacity of existing for-profit nursing homes. Strengthening the Long-Term Care Ombudsman Program Reform Act, passing legislation to increase the effectiveness of the Ombudsman Program, and codifying the Health Emergency Response Data System, pushing data on the Department of Health website. We trust that nursing homes and long-term care facilities to take care of our loved ones for their treatment and their care. So it's so important that we continue to hear from the public, hear from the family members of individuals, so we can continue to pass legislation. Some of the greatest pieces of legislation actually come from constituents that walk into my office. A woman walked in, said she didn't have the money. Her insurance wouldn't cover a 3D mammogram that her doctor had prescribed for. So we introduced legislation. And now when you go for a mammogram, you're able to get it completely covered by insurance with no copay or deductible. It's a law that they're looking to replicate around the country. In wrapping up, I just want to ask you to join us for some upcoming events on Tuesday, April 6th from 7 to 8 with the Sanitation Commissioner on Facebook, our town hall. On Thursday, April 8th from 12 to 2 is our no-cost face mask giveaway. And I see my dedicated staff member, Madison Thomas. She started with me in Albany last session as an intern and is in our district office as a liaison. She's fabulous. And she runs the no-cost face covering giveaway every week on Thursday. And we also give away hand sanitizer. We have the Zoom virtual knitting back by popular demand. We used to allow Jill Eisner and the knitters to come into the boardroom, and now we're doing it by Zoom. That started back up. On Tuesday, April 13th at 2 o'clock, we have our free pro bono legal counsel to give housing advice. So we encourage you to tell your neighbors, friends, anyone that needs housing legal advice. That's Tuesday, April 13th at 2 o'clock. So again, I want to thank you all for what you're doing on the community board. And Will, I see you. Thank you for your dedication. And Russell Squire, the new chair of the community board, for all that you're doing. And look forward to seeing you around the neighborhood. Thanks so much, everyone.
Thank you, Rebecca.
Thanks. And quickly before we continue, Will has placed a link to the package of 11 bills that we're talking about right now in the chat.
Okay.
If my research is correct, 2 have been signed into law, 4 have passed the Senate and the Assembly, 4 have passed the Senate, and 1 is on the Senate floor calendar. So you can look, open the link, and follow along.
Thank you.
While we continue discussing.
Wonderful, Deirdre. Thank you so much for waiting. And
Oh, sure, not a problem.
it was interesting.
The next bill that I wanted to mention is the nursing home ratings, which it's already in place. It's just I think an amendment to what is already in place. The nursing home ratings are on CMS's website. They are on the Department of Health's website, although it's not easy to find, but they're not located on each facility's website. This wasn't a requirement. And this bill makes it a requirement that facilities post their ratings on their websites. Usually when a facility posts their ratings, they're usually rated at a 5-star.
Right.
No one wants to rate 4 or a 2-star facility.
Right.
But this bill will push facilities to do so, and it gives some transparency so that, you know, potential residents or family members or whomever is seeking long-term care in a nursing home can see what the facility's ratings are versus maybe not knowing that they can go to CMS's website or they can go to the Department of Health's website. Because even sometimes our office, we receive calls trying to get information on particular facilities of interest, and you know that stakeholder is not aware that they can go to CMS's website, they can go to the Department of Health's website. They usually go right to the facility's website thinking that they can find the information that they're looking for. So this will hold facilities accountable in posting their ratings. So it has everyone on the same page, CMS, the Department of Health, and each facility. The other bill that I already spoke about, the compassionate care visit, the which the bill passed already. Another bill that I'm hoping that will move forward for the governor's signature is the infection inspection audit. This is a new bill. This came out of course, COVID, where it will require the Department of Health to have a audit checklist when they go into a facility to inspect based on infection control. And it holds the facility accountable for being able to pass 80%. If they do not make the 80% percentile, then the facility is liable for not only deficiencies, but to lose their license, depending on the severity of the deficiencies. So, and this information would be required to be made public. So it gives that transparency to potential, residents, families, stakeholders, whomever is interested in that particular facility for whatever reason. I spoke about the transfer discharge voluntary bill already, which passed. The bill that looks into the standards for ownership. This is another bill that is long overdue, I think. There are many facilities, and I'm speaking of nursing homes, excuse me, in particular, that people are not aware who owns those facilities. And a lot of times it's hard for the Department of Health to keep up because the ownership changes and the documentation is not clear. And when a facility is cited and enforcement is instilled on that particular facility, they wind up sometimes maneuvering where the facility's ownership takes on underhandedly different ownerships, and no one knows who owns it. The information is not updated on a regular basis how it should be. If the facility is sold to a particular proprietor or to a particular corporation, it takes months, years for that information to be made public. And a lot of times, by the time you figure it out, that facility has already changed hands to someone else. So it enforces facilities to be more transparent about ownership, and also it holds facilities accountable for not being able to buy, purchase, partner with a facility with a facility that they've had a history. So for example, if a corporation has poor ratings, if they're, a 2-star facility and they want to buy another facility, it holds that corporation accountable for not being able to be so quick in buying another nursing home or buying another assisted living facility or buying an adult home because of the negative history that particular corporation has had. It's enforcing the Department of Health to hold these facilities accountable and not allowing these owners to purchase multiple facilities knowing that they provide poor care. So that bill is critical too, because there are a few corporations out there that own multiple facilities, and they may have like a 5-star facility in one area, and meanwhile they have another facility that's a 2-star. So this bill is saying that you can't buy up nursing homes or you can't buy up long-term care facilities when you're not doing what you're supposed to be doing for one facility. How can you buy other facilities as well? So that bill will also allow facilities or enforce facilities to make their ownership documents public. Because like I said, there are multiple facilities that, people don't know who owns them. We try to keep up with them. You may know the name of the corporation that owns it, but you don't know the partners within that corporation. So trying to keep up with that is very time consuming. And a lot of times you come out, on the negative end because you're not able to find that information. Another bill is the Department of Health death records. It is requiring the Department of Health and the county registrar to ensure that when someone passes away, a nursing home resident passes away of COVID, to confirm the cause of death and to also document the last place of residency prior to that resident's passing. So we know throughout this pandemic that there were multiple residents transferred from the nursing homes to hospitals, and the nursing homes were not counting those residents' deaths as their deaths. The hospitals were counting those deaths. And being in the height of these questionings of administrators, I mean, I would ask administrators, how can you not count resident Mr. John as your resident just because you sent him to the hospital? That's his legal residency. So he is your resident. But nursing homes were getting away with not indicating that these residents were their residents and they died of COVID-related illnesses. So this bill will enforce the Department of Health, the county registrar, and facilities to count deaths appropriately and make that information known to the public. Because it took up until May for the Department of Health, May of last year, for the Department of Health to actually release the deaths of nursing home residents. And it didn't start out where they were individualizing each nursing home. It started out by they were counting it by the counties. And advocates continuously pushed for Department of Health to calculate how many residents died at each facility, how many residents died of COVID-related illnesses at each facility. So that information wasn't made known to the public until late May. And a lot of, families and other stakeholders still were not confident that those numbers were accurate. So this bill is to coincide with what transpired early on in the pandemic, and in hopes that they could get real transparency moving forward once this bill is signed by the governor. The last bill is the transparency violation. This bill also holds facilities accountable for their citations. Again, a lot of times, families, residents, they don't know where to look for when a facility has been cited. What type of deficiencies does the facility have? What was their last survey results? By regulation, each facility is supposed to post their last survey results in their facility in an open area. And a lot of times the facilities do not do so. So either you have that option of seeing it in the actual facility or going on the Department of Health's website to look as to what the facility was cited for, when was their last inspection. Also, something that's not normally publicized, which I'm really happy to see that it was indicated in this bill, is enforcement. Facilities usually do not publicly post when they have been enforced to pay a fine. And what I would have liked to see in another bill is facilities when they're cited, when they're given deficiencies and they complete their plan of correction, and the Department of Health says, no, this plan of correction is not good enough, this deficiency, this citation will stand, and you will be penalized monetarily for it. They're not penalized immediately. It takes years for that facility to be penalized monetarily. And that information is not publicized on an ongoing basis. You actually have to really know how to maneuver through the Department of Health's website to get that information as to when a facility was enforced to pay a fine. And when you look at the Department of Health's website and you actually go back through the spreadsheet, because that's what it is, it's like an Excel spreadsheet, and you look back and you see we're in 2021 now. It'll take, if a facility was cited this year for a particular deficiency, it'll take the Department of Health at least 1 to 2 years to send that enforcement letter to that facility requesting that whatever fine it is, it could be $5,000, $2,000, $10,000. It takes them a long time to be penalized monetarily. And I think that if facilities were penalized immediately, they would think twice about doing some of these things that they're doing. But it is like getting a slap on the wrist where they feel that there's no consequences immediately, so why should I have to change what my practices are? I'll just deal with the fine later on and continue doing what I've been doing. So this bill requires the facility to inform residents and families in written form of any citations that they've had, any previous inspections, when were those inspections, how many deficiencies they received. So based on what the bill indicates, I would give an example that this information could be listed in the facility's admission agreement or a residence right packet, or posted in a bulletin board when someone first enters the facility. But this bill indicates that it must be in writing, which is great. So I would expect for it to be listed in their admission agreement so that families and residents could review it, question it, have a conversation with the facility about what they've done to change their practices, and how much money they were fined. Also seeing a pattern of citations. It would be great for a family member and a resident to have that knowledge, because if a facility is constantly being cited on a particular issue, then that's a problem. And that's all the bills that I wanted to present.
And just to clarify, when you were describing that last piece of legislation and what you wish to see about things happening more immediately, do you think the bill is weakened by the fact that it would take the Department of Health 1 to 2 years, as you said?
No, it won't now, right? That's how it is presently with the bill.
That's how it's presently, but this bill in particular, it mentions, Rebecca, the enforcement. So for example, if a facility received an enforcement letter that they had to pay a fine of $10,000, they received the letter today. They may not have to pay that fine until 2022, 2023.
The way it is right now.
Right, the way it is right now. So a family member won't know that
Right.
that facility actually paid that fine. So there is some transparency there, but it doesn't go far enough.
But the bill would change that. Am I right?
Right, right. And having a separate bill would probably do better as, you know, just enforcing the time frame when facilities have to pay a monetary fine.
Okay.
Okay, thank you so much, Deirdre, for your presentation. It was very thorough. And I'd like to open it up for people to ask questions.
Sure.
So we have a lot of hands raised right now, but just a reminder to go to the reactions button at the bottom of your screen to find the raise hand button, or if you're on your phone, it's *9 to raise your hand.
We have 2 members of the public with their hands raised right now. Let's start with Jill Eisner.
That was fast. Ooh, I am ready. Okay. I have a couple of questions with regard to, you talk about staff. In some of the nursing homes, which were, quote, closed, as we just heard, none of the family members could come in, no compassionate care. The staff, which was not vaccinated and not tested, kept on bringing in illnesses and specifically COVID back into the facility at Kohler, which is where I'm on the community advisory board. And I just want to understand, how is it that these hospitals, specifically the public ones, do not mandate that if you are not vaccinated, you can't work?
Well, it's not required. Being vaccinated is not required by any employer. And I understand the concern, the severity of your concern. And you're not the only one, Jill, that has expressed this issue, because as we move through 2020, seeing that residents, even before the vaccine, seeing that residents were being tested on a weekly basis, as well as staff being tested every time they were to report to work, seeing that the residents were not testing positive, but the staff members were testing positive, it really set a precedent that the staff, yes, unfortunately, were the problem. And bringing this illness into the facilities, you know, the Department of Health did not provide any, nor CMS, no government entity provided any real guidance other than testing of a staff member to try to combat or alleviate those staff members from coming in. Testing them was the only route that they took to try to prevent the spread, which it didn't happen. But now we have the vaccine, and staff members are not mandated, they're not required to be vaccinated. And no employer at this particular time can do so. And I'm not an attorney, but I believe that there is a human right aspect to this.
Is that okay, Jill? Or Rebecca, do you want to?
Okay.
Next,
I just,
Judy.
oh, sorry. Just to complete, you
Go
said
ahead,
okay.
Jill.
That should be a bill. You know, some people here know that I was extremely sick and in the hospital for quite a long period of time. And I was just appalled that some of the people that were taking care of me could be bringing it back in. And I just think that's a bill that's missing that you should be advocating for, because that Kohler long-term where the people were locked in there for, a year. They could never get visitors because a new staff member would bring the illness back in because they weren't going off campus, and then they'd be shut down for another 28 days. So I definitely think there's the bill that needs to be put forth. Vaccine or you can't work.
Thank you.
I think employers are allowed to require vaccination so long as they make reasonable accommodations, but I do not believe it would be constitutional to mandate that ordinary citizens be vaccinated.
We do
So
that
I think
with
it's
schools.
currently just at the discretion.
A child can't go to school if they don't have certain vaccines, with rare exceptions. I mean, there are exceptions to the rule, but in a general way that you can't go with. I think even the flu, if I don't know if anybody has young children, even the flu vaccine, I think that they need, if I'm not mistaken.
Well, that was just recent, Barbara, in regards to the children with the flu. But like I have stated to, others, it's great that you mentioned the flu vaccine, because that's not even a requirement in a long-term care setting. Staff members are given the option to take the flu shot. And this was, approved by the Department of Health. If you do not take the flu shot as a staff member, you have to utilize a mask throughout the entire flu season. You can report to work, but you have to utilize a mask throughout the entire flu season. That was their guidance and regulation for staff members working in long-term care facilities. That was the only requirement, that they wore a mask if they refused to take the flu vaccine. I think there needs to be education for staff members, whether it's a hospital setting or whether it's a long-term care setting. There's so much speculation, there's so much propaganda, there's so much misinformation, there's so much mistrust. And a lot of the mistrust is happening with staff members who are healthcare professionals. And I think there needs to be a stronger focus on educating them. And I don't think that there is at this particular time.
Maybe that would be another thing that we can advocate. I want to talk about whether we need resolutions or anything at the end. If I may say, Jill, I did not know you were sick, and I'm hoping you're on the mend, and I'm very sorry. Must have been a scary time.
Next, we have Judy Birdie.
Good evening. Am I unmuted?
No, you're good.
I'm good, thank you. Good evening. I'm a member of the COLA Community Advisory Board for many, many years. I'm also the chair of the COLA Auxiliary. I know many of the people already know me. I've been on a lot of Zoom meetings. I'll tell you one thing, COLA now has, the first day you come to work, the staff has to get an instant test and an overnight COVID test and another test the same week. Staff is still bringing in COVID. They're still testing positive. Holiday week was last week. People come in with COVID, testing positive. For every single staff member that tests positive, that has a patient, works on a patient unit, the entire unit is penalized for 2 weeks. I mean, there has to be a better way. I mean, it is just cruelty at this point. And it's also horrible. The administration is completely frustrated. You have a few people who constantly test positive, and for no reason, it just happens. And the administration, the patients are thoroughly discouraged, and the state health department does nothing. They come in, they say you're closed. out of 500 people to be penalized because one or two staff members tested positive. And also the variation of rules. One nursing home does not permit relatives to come in and bring anything other than themselves. They can't bring a tissue for the person. At Kohler, residents can send a package and it will be taken up to the resident. Every nursing home seems to be running on their own schedule, their own plans. It is not consistent. The 35-page memo that the State Health Department sends out just is more confusing. It seems that the last 3 memos were the same thing, just rewritten in different language. Also, I have a question. Who are the people at the Department of Health? It's this great unknown body. Who are the gods in Albany? Can you please tell us, Deirdre, who are these people aside from the governor? Aside from Zucker? Who are making the decisions? What are their educations? What is their knowledge? Could you please give us the answer to that? Thank you.
Off the top of my head, I see Lynn laughing. Off the top of my head, in Albany, there are 2 entities. There's the Albany entity, and then there's the regional level. Mm-hmm. Here on the regional level, the director of the nursing home oversight surveillance is Ms. Shawn Dudley. And the Albany oversight is Sheila McGarvey. Mm-hmm. I will send Barbara their names.
Great. Send it to Will. If you send it to me, I'll send it to Will.
Yep, I'll share their names with you. They are the oversights, the directors. Sheila's on the Albany level. Shawn is on the regional level. So New York City area. I don't know who the other, of course you all may not care, but there are other regional directors who oversee like Westchester, Suffolk, every county has their like local DOH, and then it's the Albany oversight.
One other brief question. It's really getting scary when you talk about the nursing homes being bought out. Famous nursing homes I know from friends that have had wonderful, wonderful reputations have been taken over and gone downhill. Very recently, very famous nursing homes that, oh God, my mother was there, my grandmother was, now it's a horror story. Yep. Who is going to be left taking care of poor people? I think it's going to be Kohler, Gouverneur, Seaview, McKinney. Those are the 4 health and hospitals nursing homes. Who is going to be left in the city of New York that's going to be a public nursing home that will take any and all and not threaten to discharge them when the insurance runs out? We really have a horrible problem listening to you. You've really brought it home, and I'm really scared about this.
Well, there are a few, and I mean a few, I don't even think past my hand, of nonprofits, nursing homes in the city now, because a lot of those facilities have gone under and took on corporate ownership. But you'll be surprised with some of the nonprofits that are still left, how they handle their business too. Some of them are in dire straits, trying to even keep up with the corporations. And it's not easy, they're saying, but the majority of the nursing homes in New York City are corporate owned. If you would like, I could share the names of the corporations. I can try to identify, I think I have a spreadsheet that indicates who owns what. But again, it's just corporate. The name is not the individual entity. If that would be helpful to you all. And again, the Department of Health is responsible for overseeing the license of these facilities, as well as the governor. And, you know, what I've learned over the years is that it's a big conflict of interest. It's a big conflict of interest. So, you know, they know who owns what facilities. They are the ones approving the licensures of these facilities. So, you know, like I said, these bills that are coming forth now by the legislators, there's a real reason why these particular bills are being put forth, because so much has transpired for too long that, you know, COVID, it just ran rampant, and they can't deny it now. They can't.
Well, thank you. Thank you very much. And I really hope all four of these bills are passed very soon. Well, some of the passed are going to be enacted, and we will have enough people in these agencies to work on enacting them and cleaning up a lot of this industry. Thanks a lot.
Thank you, Judy.
You're welcome.
Next, we'll turn to a public member of our committee, Meryl Brodsky.
Thank you. Okay, I thought Deirdre's address and analysis of the legislation was pertinent and interesting. Let me ask you this, Deirdre. If you could nail from those pieces of legislation that you mentioned, any provisions that would somehow prevent the kind of catastrophe that New York State has witnessed via the nursing home scandal, and perhaps for no other reason than lack of knowing about the disease and what to do in the event of a hospital overload and a crisis. Is there legislation, and among those pieces that you've mentioned and analyzed quite well, something that nails the issue here? You know, you have to transmit these individuals to rehab. It's profitable. It beats Medicaid, the Medicare services. It's adult homes, it's assisted living, and it's nursing homes. And of course, people need to be paid, and you need extra staff and so forth and so on, and you need great nursing services. But what happened? We didn't know enough about COVID to say, well, we can't keep these people in nursing homes. They'll be in closeted environments where they'll be exposed to the virus. Nobody knew how severe it was, why it affected the elderly, et cetera, et cetera. Is there something in the legislation that nails these problems?
Well, not in these particular bills, Meryl. What I know and I can share that came about we're already in April now. In February, you know, as you mentioned, so much went on at the beginning of the pandemic that patients, because they weren't residents, patients who were positive were being transferred into long-term care facilities. And that was one of the governor's worst decisions. Worse. That I don't understand. Still to this day, I don't understand how he allowed that. And
regardless of right, wrong, or different, I just want to ask you, what were the possibilities? What were the alternative choices to moving people who were elderly and getting sicker by the day? Where could they have gone?
To me, there was guidance about COVID-only facilities, but that would have taken a lot of work. So transferring sick patients from the hospital to the ship that former President Trump provided, or maybe to the Javits Center, or maybe the other makeshift hospitals, to alleviate those patients from coming in and infecting the residents at nursing homes. Residents.
You mean so people like yourself could kind of,
go ahead. I'm
people
sorry.
like yourself could think these things through and come up with a solution to sort of quarantine those who are already infected and kind of separate them from the others if they had these floating facilities and these makeshift hospital, arenas and so on and so forth, which were all a thing, that was all original work. Nobody knew the severity of this pandemic at the time.
Right. And this is what, I mean, in the height of the pandemic, that was a question that I asked on an ongoing basis. Why are you transferring patients into the facilities? But, the blame was, again, that the staff was bringing it in. It wasn't patients coming in, bringing it in. It was totally untrue. The patients who were transferred to long-term care facilities, they had a definite impact on the virus rate in long-term care facilities, in nursing homes. And they should have never been transferred to nursing homes. Other alternatives should have been made for those patients, and the nursing home residents should have remained in place and tried to be taken care of in their space. And why other, I've never been, for example, inside Kohler. I don't know how the makeup is, but other facilities every facility is made up differently. And when you have 3 and 4 residents sharing a room in a small space, that's a problem. And again, you look at it and say, why? It's all about profit. And there was conversation, and I'm hoping that this continued conversation happens. I know Assemblyman Gottfried is aware of this. You have facilities that have 3 and 4 bedrooms, residents in a bedroom. That should not be. It should be either a private room or a semi-private room max. Because in a congregate setting, we've learned that this virus spreads, and there was no way to separate residents that needed to be separated. So that was another problem as well too, in-house, but no one was talking about that. So that's my take on it, Meryl, that those patients should have not been sent to long-term care facilities. Other alternatives should have been made, but the governor has appeared to have been focused on hospital patients versus long-term care patients. And that's my opinion.
I appreciate your opinion very much, and I wish there were people like yourself who could have tried to resolve some of those things, because you have a familiarity with the regional landscape of the various facilities, how they're equipped, and so on and so forth. So it seems to me we still have plenty of work in the way of long-term care and pandemic-related illness in the future.
Definitely.
Thank you.
You're welcome.
Next,
thank you, Meryl.
Lori.
Hi.
Hi.
Ms. Garrett Scott, I want to thank you so much.
Oh, you can call me Deirdre. You can call me Deirdre. That's fine.
Okay, Deirdre, thank you. And I want to thank you so much for illuminating many of these issues. People are getting tired of hearing me say this, but I have multiple sclerosis, and I have, been involved in looking at these alternatives for a very long time. And so I'm somewhat familiar, though it changes a lot, about the differences and the availability of Medicaid and Medicare. But so I have a couple of just questions. And the first question is, did you say, and I think that you said, that the for-profit, the people who are running the for-profit nursing homes, and I'm always very big on saying follow the money, by the way, they get more, there's better reimbursement from Medicare. Is that correct?
That's
from
correct.
Medicaid?
That's
Okay.
correct, because the dollar amount is higher for rehab. Medicare pays for skilled nursing.
Right. Okay. And also from when this I learned a long time ago, so I'm not sure if this is still the case, but I believe it is. When you, in order for you to go to a nursing home under Medicare's umbrella, the rules, you have to go directly from the hospital to the facility. Is that correct? It's like
That's correct.
All right. So the issue for me anyway is that you cannot, like, we all kind of want to believe that like Medicare is, you know, the insurance company, the insurance issue that is provided, that we all pay into, and that it's going to take care of us when we're older. But the fact of the matter is that there really isn't long-term care available under Medicare unless you go directly from the hospital to the nursing home. And even if you do, it doesn't guarantee that you're going to be able to stay there. Is that correct?
Well, one, it is correct, Lori. Medicare only pays for skilled services. So you have to have some sort of skill in order for Medicare to pay, such as rehab, a wound, those type of services in order for Medicare to pay. And it's, you know, a certain time frame. You only allotted 100 days for skilled nursing. So it's Medicaid that pays for a resident's care, custodial care.
Right.
Those are the quote unquote, long-term care residents.
Right. Okay.
So Medicare does not pay for long-term care. No.
Right. So thank you. Thank you for saying that. And thank you for stating that, you know, definitively. Because there is, I believe, a misapprehension or miseducation among a lot of people that like Medicare is going to be there for you when you can no longer, you know, walk or talk or, you know, whatever it is that you cannot do any longer. And further on that issue is that for people like myself who have been diagnosed, you know, I have a pre-existing condition, you know, we can't buy even, you know, a long-term insurance policy or something. Like if I wanted to think about it, it doesn't matter because it's not available to me. You know, it's not available to people who have a pre-existing condition. So I guess I just want to, I had someone say to me a long time ago when I went to a seminar that it was an attorney, you know, a legal day. And the attorney said to me, well, you know, you're doing fine now, but when you get to the point where you need care, we can impoverish you. And that will get you, you know, eligible for Medicaid, and you can go from there. So, I mean, I was both shocked and you know, and reassured, I guess, that there was another option. But I would really like it for people to be aware of this desperately needed issue that we really all face, you know, that all of us face this. It's like, if you cannot afford the gazillions of dollars that it costs to get yourself into a private facility, you are screwed, you know, basically, to use the vernacular. But anyway.
You're right, Lori. And to just dig a little further in regards to Medicare, it's Medicare, you have to have a supplemental insurance to assist with paying for a long-term care facility. For example, if you're going in for short-term rehab, because Medicare only pays in full for the first 20 days. After the 21st day, you're responsible for a copayment. So if the facility is keeping you, you know, for 30 days or for 60 days, that adds up, and that copayment is daily. So a lot of times, you know, someone coming in, a senior or someone who's disabled who needs rehab, they have no idea of their benefits. They have no idea. There's no plan in place prior to. And, when they get to the facility, that's when they find out when day 21 comes and they're scrambling saying, oh no, I can't afford to stay here. I have to leave. So they leave prematurely, not healed, not taken care of. And then it's like a cycle. They go back to the hospital and then they go back to the rehab. And eventually, someone says, well, maybe, do you think you're eligible for Medicaid? Let's see if you're eligible for Medicaid to cover the co-insurance at least. And then you can at least, if you are eligible for Medicaid, you can have that, we can try to work with you to convert it to community Medicaid, where you can get some home care services, because Medicare doesn't pay for home care services either.
Right.
There's so much education that's needed on Medicare alone that, so many stakeholders have no idea of.
Yeah.
So you're absolutely right.
Yeah, well, thank you very much. I mean, you have done like an amazing service by coming to talk about this, and I hope that we can finally start to spread the word about this. And I just want to say thank you so much. Yeah.
Yeah, we'll do it. Thank you. Are there more questions? I have a load. Okay, thank you.
I noticed that Alita has to leave, so I don't know if you want to let her go before Lynn, if that's okay.
Yeah, let's go to Alita first then.
That's really very gracious and generous. Thank you so much. I just wanted to say that being on the Kohler Task Force, that the issue of the staff vaccination, which I am just repeating. Oh, and hi, Deirdre.
Hi, Alita.
And hi, Jill. I'm glad to hear that you're feeling better and hope you continue to recover. But the idea of the staff not being vaccinated and the impact that it has had on the residents, someone used the word cruel. It's more than cruel. These people are able to go out and visit with family and friends and maybe dine in restaurants and maybe go to one of those clubs that's not supposed to be existing. And then they come in and they infect the people who have no choice and can't do anything. And it's just wrong. So I would fully support, Barbara and Rebecca and Wilma, a resolution in favor of doing something about either requiring staff vaccinations or education for staff, because if 80% of the residents are getting vaccinated, then something needs to be done for the rest of the staff. Whatever you guys can come up with, even if I'm not here this evening, I would support it at the full board because, and I'm sorry for the background noise. I think it's so.
Can we take your vote if not here? I don't know if that's legal. I would like to know that.
No,
it's
no.
Not legal.
But I just wanted to tell you that
something to it. My feeling is, seatbelt laws, if you don't wear a seatbelt, that's your problem. This is not. If I don't get vaccinated, then I'm affecting you. That we are all interrelated and affect each other. And to me, it's just awful. I wish that we can have a rule about it. I know that there's privacy problems, and I assume there's always exceptions to the rule if you have some, allergies or something like that. My daughter-in-law is pregnant, and she's vacillating whether she should get vaccinated. I certainly understand that. But for the most part, it's just wrong that somebody will totally affect somebody else's life because they won't do this.
Exactly right. And maybe there are places where unvaccinated staff could work, where they're not in contact with anybody else. I understand that there are perhaps constitutional issues or other issues, but they're not working in the back shelves of a grocery store or something. They're having direct contact with the most vulnerable people. And the highest death rate from COVID has been in nursing homes. So the fact that they're still with that, and the mental health of these people has not, I think, been adequately assessed and understood. It has an impact on all of us who are able to get around and go to the grocery store and talk to people. They don't have visitors. They don't have the ability to go out. They haven't been able to go into the town and go to the grocery store or just walk on Main Street. It's fully
and you're co-chair of the small business. It affects the small businesses. If we can't go into the small businesses, then we're not going to recover in any way.
Right.
So-
So I'll just end with that there needs to be something done, whether it's education or a requirement or almost a quarantine of where they're working, but something, because the health, mental and physical of the residents at these nursing homes needs to be a priority, I think. Anyway, thank you so
Thank
much.
you.
So
Okay.
whatever
So
you
full board,
And
I support.
I will let you know.
just to further clarify, I did a little bit more research just to make sure what I said earlier was true. And experts say it is probably legal for employers to make vaccination a condition of employment. The Federal Equal Opportunity Employment Commission has agreed, so long as it mandates, permits health and religious exemptions.
Yep. And I think that's other
I think that if we're going to do a resolution, we can't really do one on making a mandate for people that are working, in nursing homes, things like that. But we can do a resolution on making sure that the people are educated as to what can happen to others around them if they are not vaccinated, other people are. And if they do pass, test positive, they should not be able to work. If this place is going to be shut down for 2 weeks, they should go away for 4 weeks, the staff.
Yeah, but then you don't have staff there. I mean, it's a vicious cycle. Then this whole thing about the staff ratio. I mean, how do you have a staff ratio if 10 of your 8 are sick and out? I mean, where do you get the replacements for it?
Well, you can't really make a mandate on them taking the vaccine because it's their right to take it or not. But it could be something done on a training.
See,
Could I add something? Because I get a lot of emails from bar associations. I'm a lawyer, and I think the EEOC allows employers in many circumstances to require vaccinations. It may be different in the public sector, but during the height of COVID, I don't know if it's still true, a lot of nurses were coming from private agencies, and that's not a public employer. So if there are nurses or staff at nursing homes that are coming from private employers or private agencies, then those people should be required to get vaccines. And maybe the staffing could be arranged to maximize their interaction, the vaccinated people interaction. So I don't know much about this, but it seems that it is permissible under many circumstances to require vaccinations. I know public-private is different.
Yeah, I think that children can't go to school unless there's, the exemptions. There will always be exemptions. They can't go to school if they don't have the measles and the other vaccine. Am I right about that? That's my memory.
That's true. You're right.
Yep.
You're right.
Yeah.
They still don't allow them to have all their vaccination, all their shots.
Right. So
They have to.
are there more questions? Because I have several.
Yeah, we have one more. We have
Okay.
one more. Lynn?
Thanks for waiting, Lynn. Sorry.
Okay. Hi, Deirdre. I am so thrilled to see you here tonight. I have learned so much from you, and I think you're an incredible and amazing advocate for people with disabilities in a nursing home. So I thank you for your work. And I do have a couple of quick questions that I wanted to ask.
Sure.
The compliance date for the essential care, allowing people in, you said it was 45 days. Does that make it like around May 14th? I want to put a circle on my calendar so that I can make sure I follow up on this.
I'm not 100% sure if it's from 45 days from when the bill passed. If that's the case, then that sounds about right. I'll reach back out to you with a more definitive answer.
So I do have a couple other questions.
Mhm.
Now, one of the things that I found very confusing was that during the pandemic, there were workers who were allowed to come into mental health to nursing care facilities who were doing, like, say, construction or stuff like that around the building. but they weren't allowing, let's say, support services like we have Angel something or other that goes into Kohler and that supports them. And then there's the Open Doors people that go in there and support them. And they were barred from entrance. Was that correct? Like, how did that net out? I'm so confused.
Well, earlier on, and I'm going back to the end of March, early April, when the guidance came down from CMS to the Department of Health, and then the Department of Health implemented guidance. No one, not even consulting physicians, were allowed to go in to see patients. Now, consulting meaning a podiatrist, an eye doctor, an ENT, those type of professionals were denied access as well. They were encouraged and told that they would have to utilize telehealth at that particular time. Beauticians, barbers were also banned. And they were banned up until, I think, the summer. The physicians, the consulting physicians were able to go back in prior to the barbers and the beauticians. And that they had to follow the same rules. The consulting physicians and the beauticians, for example, they had to follow the same rules. So if the facility was on quarantine, they couldn't go in either. If the facility was not on quarantine, then they could go in. But that's more, excuse me, that's more so for the consulting physicians. But it took a while for the beauticians and the barbers to go in because separate guidance had to come down from the Department of Health to allow that to happen. So it's everyone, including Ombudsman. We were locked out as well.
Now, are you able to go into the facilities now?
Now we are able to, we've been able to go in, this is April, time is flying. Since I think late January, early February.
So
Yes.
I had one last question for you, and it has to do with who qualifies to be in a nursing home facility versus one of the complaints that we've been receiving from residents is that there are people who have severe mental health illnesses and without knowing exact diagnoses, which sound like they could be things like schizophrenic and stuff like that, who are being housed in the nursing home rather than a mental health facility. How does that work? And is there a way to help facilitate somebody who has severe mental health issues who are in a nursing home to be put in a position where they're in the correct care for their health issues?
Well, I clearly understand this question, and there aren't many mental health hospitals anymore. The ones that are open are state facilities. There aren't any private entities. So, and truth be told, you know, sometimes those hospitals, meaning those hospitals that care for people with mental health disabilities, they stabilize patients and they send them to their discharge to either a nursing home setting or an adult home setting. Facilities may take a resident with a mental health disability for other reasons. There should be definitely a medical reason as to why they take the resident. The resident can't care for themselves. But a lot of times, you know, coming from the facility's perspective, they will tell you that, you know, we got stuck with this patient. Where are we going to send this patient? We have to do the best that we can to care for this patient. And to be quite honest, they more than likely could do the work to care for the resident if they spent the money to provide the adequate services, such as not only a psychiatrist, but a therapist, invest in programs that would engage a resident and improve the resident's quality of life, and not just medicate a resident where they are to a point where they're a zombie, just like with a resident with dementia. Facilities don't invest in proper care for residents.
Doesn't that go back to some of the staffing issues? And you were talking about that staffing issue, Bill. And so here's the other thing that I'm confused about. Aren't they supposed to keep staffing records? Isn't that supposed to be part of their public record, like how well they've been staffing? And my confusion comes from, you have, as of, I think it was 2 weeks ago, 13 staff members tested positive. So then you have those 13 staff members, and then isn't it anybody else that may have been exposed to them for a certain amount of period of time are supposed to quarantine? And if you look at the potential rollout of those numbers, you're talking about 1 week where you may be down as much as 10% of your staff because of the people testing positive, the staff members testing positive. Am I misunderstanding this?
No, you're not. And this is why this particular bill should have passed more than 15 years ago. Because CMS, the federal government, requires nursing homes to report their staffing levels. Right, you're reporting it, you're making it public, and the public is only seeing that you have issues with staffing, but there's no mandate. And this is what this bill will do, mandate a percentage of a ratio, to have that ratio of caregivers to a resident. You're just reporting because advocates and other stakeholders have complained about short staffing. Okay, so we'll solve this problem by having facilities be transparent and report their staffing levels. Okay, you're reporting it, but you're not enforcing the facilities to do anything about it to improve it. So this is what this bill is about. And I think it's a little backwards. If they had this bill first, if they had passed this bill years ago, we probably wouldn't be dealing with the issue that we're dealing with now. So you're absolutely right.
Thank you, Deirdre, for your time. Super appreciate. I've learned so much from you, and I can hope to continue to do so.
Thanks, Lynn.
Thank you.
We have one more question from Russell.
Hey, Deirdre.
Hey, Russell.
So my question is, it sounds like we may be doing a resolution, and I guess we're not sure, or I'm not sure yet what the resolution is, but if it's going to relate to the bills, one of the issues that's come up in the past is, when we've taken resolutions to the full board, is there's been a fair amount of, or people who wanted to afford basically deference to the Department of Health, who had been sort of hesitant to be supportive of anything that's going to mandate the Department of Health to do anything or to make any changes, on the sort of theory that, the Department of Health, they're the experts and we don't want political interference in what they're doing. Essentially that's the concern. And so I am hoping maybe you can, I guess my question is, what's your view on it, and why should we not be concerned about that, and can you arm us with some counter arguments basically in that regard?
Well, I mean, the Department of Health, and I'm not too sure how many people understand, the Department of Health is a regulatory entity. So if the regulatory entity is not being held responsible for enforcing and providing guidance, and not even guidance. There has to be strict regulations, and that's the difference. When the Department of Health, and that's all that has come out of COVID from CMS and from DOH is guidance. There has been no regulation law to mandate facilities to do X, Y, and Z during this pandemic. It is just guidance. And if the council feels that the Department of Health, that you all can't hold the Department of Health accountable, I don't know who else you're going to hold accountable. There has to be, and I've said this in one of the Kohler meetings, the challenge would be to challenge DOH. And there's not too many people, Russell, who, and I mean people, stakeholders who have tried to hold them accountable. And I think Community Board 8 should move forward in doing so. Because if you don't, you've taken on a cause. First of all, you all have taken on a cause that no other community board has. I'm born and raised in New York, and I have not seen in my time with the Ombudsman program any community board that has been so actively involved with the nursing home sector. So you all have taken this pledge, this oath, to try to make change for long-term care residents, in particular Kohler residents. It starts with protesting, speaking out, enforcing the Department of Health to hold facilities accountable for the mishaps that happen, calling them out on things that they're not doing, calling them out on the guidance that they've changed, I don't know, 5 different times to say the same thing that hasn't been beneficial or hadn't been beneficial to residents. Because the residents feel, and I'm talking from experience, and not only from Kohler residents, I'm talking about residents throughout New York City. When the Department of Health goes into a nursing home, that's the residents' one chance. When they go into, when DOH does their annual surveys for facilities, the residents, that's their one chance to have communication face-to-face with the Department of Health. And every time, these residents are gravely disappointed because they feel that the Department of Health does not listen to them. The Department of Health does not enforce change. The Department of Health will tell them, if it's not a regulation, we can't cite the facility. Yeah, you can complain, but if it's not cited, if it's not a regulation, we can't cite them. So there's no justification. There's no justice for the residents. So you all are taking on this cause to help Kohler residents. You all should move forward with pushing the Department of Health to better their, I don't know if I want to say their, better their, do a better job. Because
Thank you. Yeah.
That's what they're supposed to do.
Russell, I also see this is quite different. I think that in the past, like if we're talking about opening swimming pools, that was such a health issue that we didn't know how dangerous a swimming pool would be. This isn't. This is really regulation for the most part of just saying we want the nursing homes to be more accountable, to make sure they're doing a better job. I don't see it as the health issue that we've all, including me, have objected to in the past. with the exception of visitation, which I do have a question about. I mean, but everything else is not, do you agree with me, Russell, that it's not really healthy?
Oh, I think we should take a position on it.
Yeah.
I mean, I think that in the past when it's come up, I think we should have taken a position on it and done it. But I just, knowing that this was an issue that came up that convinced a lot of people that, you know, that we shouldn't do it. That's why I wanted to have it addressed, because I think it's useful to have Deirdre try to allay those concerns and get just sort of a more authoritative view on it. And I think she put it very well in terms of it being our responsibility, and I agree with what she said.
Right.
Luckily, yeah, as we discussed earlier, that specific bill.
Can I?
Yeah, can I just finish really quickly?
Sure.
That bill has already been passed. The remaining legislation that in this package is much more about regulation and transparency and accountability. So I don't think we should have a problem. I think we could also include Deirdre's suggestion about tightening the time frame for payments as an additional whereas clause. The only thing I agree with Wilma, or I agree with Wilma a lot, but what I agree with what she said earlier, that it might be harder to pass a resolution mandating vaccination. But I think for the legislation and Deirdre's additional suggestion, I think we would be able to do that.
Well,
yeah,
I think we could try. I think some of us we could try. Can I just ask a couple of questions before? One is general question, Deirdre. First of all, thank you so much. I mean, as everybody has said, it's been wonderful.
Can I just say something to Russell?
Sure.
With his question, I think, and this is for the entire council, if not now, when? If we haven't learned anything from COVID,
right,
we have to take advantage of this opportunity.
Right.
Because
I agree with you. Yeah.
Everyone is listening. Right. People who weren't listening before, they're listening now. So I think this is the perfect opportunity for the council to take on the Department of Health.
Yeah, I agree. I feel the same way.
I agree.
Okay.
I'm sorry, Barbara. Go ahead.
Oh, there's one. Just generally, these questions are, these bills are permanent, or are some of them only related to COVID?
No, these are nursing reform bills. These are all permanent bills. It just came from the pandemic. These issues were heightened because of the pandemic, but these are as I say, personal. These are permanent bills.
Great. So like the visitation, I don't know when it would be relevant outside of the COVID situation.
So if there is ever any health emergency, if we ever have another pandemic,
or even the
if the facility needs to be shut down for any reason, this bill will still stand.
Okay, that's great. I just don't understand the whole nursing, the counting the death. Let me just ask one question. If somebody gets a heart attack in a nursing home and goes to the hospital and dies in the hospital, where is that death counted?
It's counted in a nursing home, because
so it is today that anything not COVID, but everything else, it does go back to the nursing home.
Well, everything prior to COVID, if a facility sent a resident to the hospital for whatever reason and they expired in the hospital, that resident is counted for that death at the facility. They report the facility, the facility will report that on their census that they had one resident's death. So COVID changed, they weren't transparent because they were under a microscope.
Right. Okay. That was, I sort of didn't understand the problem with it, but I do have one about the, is it called compassionate? In other words, when
essential care.
Yeah, the compassionate care. I did listen to the governor's daily briefings in the beginning days, and so we now have established that it was wrong that he was sending people back to the nursing home. But what he said is if the nursing home can't take care of them, they could always be sent someplace else if they didn't have private rooms or enough health care or whatever. Would that have been a reason and a legitimate reason if the nursing home just says that you've gotten sicker and we just can't handle your illness. You've gotten mentally ill at this point, or we can't handle it. Is that a legitimate reason for a nursing home to say you must leave and go someplace else?
Right. If for example, when in the height of the pandemic,
right,
if they had short staff, for example,
mm-hmm.
facilities were saying, because I was in communication with a lot of administrators, they were saying that they were reaching out to DOH for guidance,
mm-hmm.
and they weren't getting it.
Oh,
there was one nursing home in Brooklyn who the CEO stated to me that he had asked DOH if he could send his residents to the Navy ship, or was it possible for transportation to be given to residents that he could no longer care for instead of sending them to the hospital? Because another thing, a lot of residents and family members were afraid to go to the hospital. So if they were sick and they couldn't care for them, they were at some facilities stated that they were asking to send the residents elsewhere, and they were denied that.
Okay,
and the residents,
that's not what I heard on
they
television.
had to send the residents to the hospital, and they may have, passed away in the hospital or come back to the facility and expired.
Okay.
But what I can say about that now, Barbara, is Johnny come lately, there are 18 COVID-only nursing homes throughout New York State. And I say Johnny come lately because this should have been in place prior to. But now, excuse me, now there are, I think, 6 here in the city that are only supposed to take COVID only. So if you're a hospital discharge planner and you have a patient that is tested positive and requires rehab or long-term care, you're only able to send that patient to any one of those 6 facilities. You can't send that resident to Kohler, that patient, excuse me, you can't send that patient to Kohler. You can't send that patient to Amsterdam House. You can't send that patient to Mary Manning Walsh.
So when hopefully COVID does end one day, what would those facilities be? Would they still be some sort of special facility? So if somebody has pneumonia or TB or something like that, they would go to a different facility? I mean, will we retrofit those facilities?
I don't know. That question I have put forth to one of the facilities designated as COVID only, and this facility is strictly COVID only. They are a 263 bed facility, and all their residents are COVID positive. The other facilities have units, but this particular facility, I was in communication with their attorney as well as the administrator. And what I was told was they have to get approval from the Department of Health to go back to quote unquote normal when the pandemic ends. So I'm quite sure there's going to be a process for that facility to transition back to the standard skilled nursing facility.
Or maybe we'll say we need it as a special facility for something else that happens.
Right, and that's up to the owner and operator if they choose to be only a specialized facility. But again, that conversation has to happen with the Department of Health because they have to get a licensure for that. That's just not something that they could say, oh, I'm going to do just because I want to do it. That has to be approved by the Department of Health.
Resolutions. Deirdre, you would agree that we should have a resolution urging and Rebecca knows the ones that are passed and not passed and so on, urging the Senate and the Assembly to pass the different ones.
Definitely,
and then for the governor
definitely to
to
get
sign
those
them.
bills to the governor. Yes, yes, without a doubt, without a doubt.
And even though I'm chair, since this is there are a small group of boards, I'll put the resolution forward urging the Senate and Assembly to pass whichever bills have not yet been passed by their respective bodies, and the governor to sign into law. And I would also add a whereas clause to ask them to create legislation to speed up the process by which nursing homes have to pay their fines in more elegant wording.
Right.
Yeah.
Can
I see Russell second that.
So we have on record the community board and public member that is here.
Yeah. So raise your hand if you want to vote no, abstain, or not vote for cause, and then I'll read the names. Okay, seeing none, it passes unanimously. It's Rebecca Dangor, Barbara Rudder, Wilma Johnson, Lori Boras, Lynn Strong-Shinozaki, Meryl Brodsky, Peter Patch, Russell Squire.
Great. And I would like to propose a resolution. I wish Alita was here so she could do it. A resolution to say, and we could copy what the rules that you read, Rebecca, that to urge a passage. Maybe Jill, you would help me. Urge a requirement by public and private entities for all employees to be, for the entities to have, to be allowed to require vaccination with the exception of religious or medical reasons. Is that right? Does anybody?
Well, do you mean strictly for nursing home and long care?
Well, okay. We could limit to that.
I just, Meryl has her hand up.
I would agree to it if it's on, if it's limited to long care.
I just want to mention.
I'm sorry, who was speaking? Was that Meryl?
Meryl.
Yeah.
I was going to let Wilma finish.
I was saying that I would agree to it if it's limited to long care.
Okay.
Long-term care would, the resolution that Barbara is talking about.
Okay. Ms.
Meryl.
Meryl, you can unmute now. Meryl, unmute if you wanted to say something.
Thank you. Thank you. Okay, the unions have now agreed to finance and to help the people, their union members, many of whom are healthcare workers, get the vaccine at CVS and the various health providers that the union uses. This is a sea change. So it's my guess that they will begin, they will put a little pressure on employers that the unions are in on this and they organize themselves to get compensated for their time. You get 4 hours if you're a union employee. Most healthcare workers that Deirdre spoke to are in fact union workers, and they will be getting their shots. They are accessible for 4 hours, and both shots are accessible to them. So I think that's a good change. Now, whether or not we can legislate that, Barbara's question is, I think our heart is in the right place. Can we do that, or is it just going to be a question of more and more employers are finding it easier to finance and give people time to do it and finding it more profitable in the long run? Obviously, they will. So they're not going to take the liability for a lot of COVID cases in their offices. And so I think that that's a good idea. It's a resolution, not legislation, unless they can get the unions to sign on to it and propose it themselves.
Yeah, but, okay, yeah.
I think, again, I don't think we can urge the government necessarily to mandate that. I think we can write a resolution encouraging the employers to do so. I think what we can probably do is Wilma's original idea, which was about education.
Right. I was going to add that too.
I saw Russell had his hand up.
Right.
Thanks. Yeah, I think if we want to mandate it, I think it does require a governmental change. I mean, this came up in the Kohler Task Force. You know, what we've been told repeatedly is that it's not permissible to require employees to be vaccinated as a condition of employment. I don't know. I mean, this was sort of touched on earlier. I don't know if I think this is what Alita was talking about. You know, I don't know if this is an issue of only, the government as an employer isn't permitted to do that or what have you. But I think the idea, and I think this is what Alita was getting at earlier, is to say that whatever the law is that says that the government can't require people to be vaccinated under circumstances like these, that's what we would like to see changed, because it's been sort of very kind of absurd to everybody looking at this to say, how is it possible that, these facilities can't tell their staff that you have to be vaccinated in places like this with vulnerable populations and all that. So I think the idea is to say whatever the law changes that needs to happen, that's what we're for, with the exceptions.
I thought it was a constitutional problem. That is why the government can't mandate any individual to be vaccinated.
As I said, schools are mandating it, so.
But that's not the government.
I don't know. Well, look, I don't know at what level of, I don't know whether it's a law or a constitutional
that's
issue.
what I was asking. Do you think
or what have you.
We should ask the Assembly, the Senate and Assembly to pass a bill to require it, or what do we ask for? I don't know if Deirdre could help or.
I mean, I think that, my own view, look, I think, if it's a constitutional issue, I think, if we're comfortable with the idea that this is something that shouldn't be permitted, again, understanding that there should be exceptions for, religious reasons or for health reasons, then if it's a constitutional change that would need to be made, then I think we could say that that's, then that's what we want also. But basically to say that, if we were going to do, I think if we were going to do a resolution on it, because we don't know precisely what the obstacle is, I think, we could word it generally to say something like, we call on state governmental authorities to implement whatever changes to the law need to be changed in order to permit long-term care facilities to require staff to be vaccinated.
I like that. Yeah. I mean, somebody could say, I won't work here. They don't want to. We're not making everybody do it. We're just saying you can't work here unless.
I have another point, but first I'll let Lynn and Meryl go.
Okay. So, am I unmuted?
Yeah.
Okay. So my question though is, maybe we can't blanket say that everybody that's employed there has to get immunized, but can we say something like that people who have direct contact with residents and or patients, depending on the facility, that they be required to be vaccinated, and then if they choose not to, then the facility can find something else for them to do until such time that that there's herd immunity within the facility. I mean, I think that the ultimate goal for all of us is to get to herd immunity. And for using Kohler as an example, the residents are at herd immunity with 80% of their residents being vaccinated, but the staff was only at, and I don't know if this has changed, but most recent statistic was 39% of the staff had been vaccinated, which isn't even close to any level of herd immunity. And how many of those unvaccinated staff are working directly with patient contact? And I think that that's the aspect of it that's most problematic, is that you have these people who are unvaccinated, like was discussed earlier, where they go on vacation, they do whatever, they come back into the facility, who knows how they've been exposed, and then they're working directly with patients. And so I think that wording is not my gift, but I think that saying it in such a way that people who can't have direct access to patients if they're not vaccinated.
Well, with that said too, Lynn, you all remember that, for example, an LPN, a CNA, even RNs, they work in multiple facilities. So,
well, one of the problems that they were having at Kohler is because of the staffing levels, you would have somebody who was working up in the with patients who had tested positive, and then the next day they would be working down on one of the floors with other residents. And so I thought that that wasn't supposed to happen. Now, what we don't know is, let's say, was that particular individual vaccinated? Is that why that was kind of allowed to happen, even though that was against protocol? I mean, there's so many things like that that are unclear, but that goes to what you were saying in terms of these levels of exposure that we can't control, but they should be controlled as far as who can be exposed to a resident.
Right. And Deirdre, wouldn't all of those, the RNs and so on, the OPNs, they have direct contact with, I mean, that would sort of fall into what Lynn is saying, that they have direct contact with the patients.
Right. The only staff members in the facilities who wouldn't have direct contact with residents are those who, excuse me, maybe working in an office like finance, but they would not on a day-to-day basis have contact with residents. But those staff members that are hands-on are the RNs, the LPNs, the CNAs, the doctors.
Right.
That population does. Yeah. The PT, OT.
I assume the ones that make the food and deliver the food and things like that.
They may have, I mean, they could reduce their contact with the residents because the food service staff aren't handing the trays to the residents directly. That's the CNAs.
Okay.
So more so, again, it goes back to that direct care staff who are highly impacting the numbers in the facilities.
So I think that Lynn's addition, those couple of words addition is good then, right?
Yeah, I mean, it's all about, I'm sorry, Rebecca, it's all about wording, and the concern would be also having this tied to being vaccinated, being tied to employment. That if I don't get vaccinated, I'm losing my job.
Mm-hmm.
Like, how is that possible? So the way it's worded would definitely make a difference. And I think Lynn is onto something that, encourage, again, education has to be put in that letter too,
So I'm doing a little bit more research, and I see that Assemblymember Gottfried has a bill A2081 that directs the Commissioner of Health to mandate a COVID-19 vaccine for residential healthcare facilities and to prioritize the distribution of such vaccines to such facilities. I'm trying to see what the
mandate
status is.
It says
Yeah,
mandate.
it says mandate, again, strictly for residential healthcare facilities.
When was that bill, Rebecca?
Like it's this is I'll send Will to put it in the chat. It was introduced on January 14th of this year. Hold on, let me send
That makes the
Will these two.
And I'll point out that not all legislation that's proposed is constitutional, and sometimes it gets signed into law. Like that is a fact. And it doesn't mean you shouldn't advocate it for it if it does something good.
That makes the resolution. If because we could just say that.
I'm still pretty torn, just because I wish I understood kind of all the legal ramifications. I think maybe could we do, I don't know if people would be interested in sending a letter and then maybe having a short meeting soon and ask Gottfried to come and talk about it and have the resolution then. I don't know if that's something that people would be interested in.
Well, I mean, a part of this bill, the title of it, the end piece of it is interesting, because when the vaccines were first implemented, and it was first stated that the nursing home population would be the first to get it, there was so much misunderstanding, miscommunication, and disparities with it. Not every facility received the vaccines, the distribution at the same time. There was a lag for other facilities. I know, for example, some facilities in Nassau County, by the time I was calling facilities here in the city, folks in Suffolk and Nassau had already had their first dose. Meanwhile, some facilities here in the city, they didn't even get, the pharmacy didn't even get to the facility as of yet. They were still waiting for a date. So I think Rebecca's idea is to having Assemblyman Godfrey join you all for clarification, I guess in particular to this proposed bill would be ideal to get some further clarification on it.
Because I also think it might include residents as well as employees, and that's complicated as well.
Right. Because knowingly, not all residents have been vaccinated.
And said 80%.
That's
so
their right.
So what should we do with this? Should we still have the original? Russell, somebody give some advice about. Deidre?
I see Meryl has her hand up.
Okay.
And then Russell.
Availability of the vaccine. As you remember, when the current vaccine, the various pharmaceutical companies began to manufacture it in quantity. It was open to not just 70-year-olds, but now 50-year-olds. Same principles going to hold for people in healthcare professionals. Now, I think Godfrey's a great idea, and I think we should have some sort of meeting on that, even if it's just we limit it to 45 minutes or whatever. I don't use that number, please. But I also think somebody from 1199, the healthcare professionals who do fill the municipal hospitals with all of the people in their categories that Deidre mentioned, would be an asset to understand if there are constitutional issues. My guess is what Russell said, if there's a religious condition and or a underlying health condition, Does that rise to the, I don't, those are subordinate constitutional issues. They're going to affect individuals and they're going to win. Is there an overarching constitutional issue? Probably not. Because of the school kids, they must be vaccinated, et cetera, et cetera. A private employer can have his way. He could ask his employees, they must work at home. Or he could ask them to come to the office. They must not have the COVID, which is akin to saying you can't work here. These are constitutional, perhaps, these are certainly employment law issues. But I think it'd be a great idea to have a meeting with Gottfried and maybe a union rep and so on. Thank you.
Russell?
Yeah, my concern is just that if we wait to have a meeting with Dick Gottfried, that we lose a month on being able to do something about it. I mean, I think I think the Gottfried bill sounds good, so we can endorse that. I think if the concern about the Dick Gottfried bill is that it might not be constitutional, or there might be some other sort of existing legal issue that prevents the Department of Health from doing the mandate that the bill is calling for, then I think that's a reason to do a sort of broader resolution along the lines of what I originally suggested, as modified the way Lynn modified it, to say basically, regardless of what this particular bill says or whether that particular bill is constitutional, to say whatever it is in the law that needs to change to allow for these facilities to require staff to be vaccinated, that's what we want, because we want them to mandate it.
Yeah, because again, this bill includes residents, not just staff.
Yeah, and I frankly, I don't think we should require, it's not as important to me, and I don't think we should require residents to be vaccinated. So in a way, there's sort of different issues. To me, the key is making sure that staff get vaccinated and that they're required to be vaccinated.
Lori?
Hi. I just wanted to say that should you desire a union person, one of my best and oldest friends is the communications director for 1199. So
Right.
I will be able, yes, I'll be able to get you somebody. I should be able to get you somebody. Okay.
Great, Lord. Okay. Do we have a resolution, Russell's resolution on the floor? Is there any more discussion? There's no more hands.
I need to think. I need to think about it for a second. But I'm wondering if, in addition, at least we could pass a resolution about educating staff.
That would be part of it, but from my feeling, that isn't enough. That it wasn't what I think that we had talked about. Is Jill still here? I don't know. That isn't what she had said to begin with.
No, I think we can do both. We can do both, but
the education would be part of that same resolution. Don't you think so?
Well, I think it would be, it could be beneficial for it to be separate, because I do think there might be some people who would not be willing to vote on the mandating vaccines, who would vote for at least the education part.
Russell, it was your resolution. What do you think?
Yeah, I think it's fine to separate them.
Okay.
And Lynn has her hand up.
Yes. We already have one resolution.
well.
What is the second one going to be on?
We're having 3 resolutions. So,
3?
well, the first one is on passing those bills that need to be passed. The second one will be on education, and the third one will be on mandating vaccines for the employees that have direct
in long-term facilities, right?
What?
In long-term facilities.
Yeah, they have
yes. Only staff and only in long-term care facilities. That's what we're talking about.
Direct staff, not all staff, but the staff that has direct.
Right, and
relationship with the patients in long-term
Right.
care.
Lynn?
I think that would be good once it gets worded.
Am I
On
on?
care.
Yeah,
So,
you're-
what we found when we started looking into educating staff members, that was part of one of the things that we were doing on the task force. And we found some information that I think I want to talk about right now. And that was the institutions and the places that had the best success rate. It wasn't by giving factual information to staff that they were able to raise the level of employees who were willing to get the vaccine. What was a game changer in multiple facilities was actually one-on-one personal discussions with each employee to find out why they personally were resistant to getting the vaccine, and then talking with somebody who was either a mentor or who had some relationship with the employee that helped facilitate that discussion and get them over whatever that tipping point was that was blocking them from wanting to get the vaccine. So my concern is, if we just say that, oh, you need to educate them more, from what we saw, that's not quite enough. It's having one-on-one discussions with reluctant staff people and having a better understanding of why that individual was against getting a vaccine, and to really talk, somebody who's knowledgeable to talk about the specific points for that person. So I just wanted to bring that up because it sounds like an easy fix to just give people information, and that, but it's from what I'm understanding in the research that we did, for the facilities who had as much as an 80% compliance rate with employees, it took having one-on-one discussions with that 40% of non-compliant employee to get an understanding with that person, to get them to a place where they felt comfortable to get the vaccine. So I'm not sure how you go about that aspect of education, but that's one of the things that we were reading articles that it took to get people to the level where they were complying.
Make it be whereas clauses. To find out the most successful, that, success rates have been a certain amount.
I just sent Will 2 more things that I found from the CDC website about, basically the question is, will I be required to get vaccinated for work? The federal government does not mandate vaccination for individuals. For some healthcare workers or essential employees, a state or local government or employer, for example, may require or mandate that workers be vaccinated as a matter of state or other law. So I think that alleviates most of my concerns. So if you don't want to go forward with the education, that's fine with me.
Great. So
I think they're both good points. I mean, I don't see why. I don't think they're mutually exclusive.
that's why I thought it should be one. I think having 2 resolutions may be complicated, maybe sound, I think it's almost clearer if it's in one resolution to say that we urge, education with some of the whereases that Lynn talked about, and then the mandate, but that would be up to, I would vote yes for whatever way.
The only reason I suggested that is at first is because if I had known this specific thing would come up, I would have done research ahead of time, but I wouldn't want to vote for something that I didn't fully understand. But this is at least enough reassurance for me. And I don't think it should include Dick Gottfried's bill, but maybe we can invite him at another time, because that I think goes further.
Okay. Can we vote? Rebecca?
I think we should vote. We got a resolution.
Rebecca?
I call the question.
Okay, I'll second it. And maybe Russell, could you just quickly state what it is? And then I'll read the names briefly.
So we call on state government officials to make whatever changes to the law are necessary to allow for long-term care facilities to require that their staff be vaccinated, or sorry, staff who have direct contact with residents be vaccinated. And then we also, I think that's the resolution. I guess, do we have to add also that we call on the publicly run facilities to also, mandate that?
Including any education or no?
Oh, and then we urge all long-term care facilities to take steps to educate their staff on the safety of vaccines.
And is this limited to only public or to all long-term care facilities, private and public, profit and nonprofit? Would you limit it, Russell?
I don't think it needs to be. I don't think it needs to be limited. I think we could just.
Even when it's a public, it's still nursing home.
Okay.
Yeah, I think it's fine to make it to not limit it and say, all long-term care facilities.
Great.
Yes.
All right.
Okay. If you'd like to vote no, abstain, or not vote for cause, raise your hand. Okay. Seeing none, it passes unanimously, and I'll read it for the record. Rebecca Dangor, Barbara Rutter, Wilma Johnson, Russell Squire, Lori Boras, Lynn Strong-Shinozaki, Meryl Brodsky, Peter Patch.
Okay.
Deirdre, this was the most interesting meeting. Thank you.
Thank you, Deirdre.
Yeah, thank you so much.
Thank you.
Can we say good night?
Motion to adjourn.
Good night.
Thank you, everybody.
Thanks everyone for having me.
Yeah.
You all stay safe.
Okay.
Thank
You
you.
too.
Good night.
Thank you, Will, so much
Of
for
course.
everything you've done.